Let's start the recording. All right, we're recording. Thank you. Okay, so I'd like to welcome everyone to our webinar series on digital technologies for COVID-19. This is the first in a weekly series of webinars where we'll be discussing the research that's going on at USC and other places as well on this important topic. I'm delighted to introduce our first speaker. So each of our webinars will have two speakers. And so our first speaker today is Professor Emilio Ferrara. He's a research assistant professor in computer science and also a research team leader at the Information Science Institute here at USC. He's also the associate director of the data science program here at the university. Emilio's research is on social media and he's done some really interesting work on a variety of topics related to social media, and he's going to be talking about those today, including things like automatically detecting bots, discovering misinformation campaigns, and so on. Emilio's has a number of awards in his name. So these include things like the 2016 DARPA Young Faculty Award, the 2016 Complex Systems Society Junior Scientific Award, the 2018 DARPA Director's Fellowship, and so on. So, and today he's going to be talking about his work on charting COVID-19 chatter on social media. So welcome, Emilio.
Right, good morning, everyone. I'm delighted to be here. So today I'm going to talk about actually almost a decade of work, and I'm trying to link several different pieces. So I'm going to talk about work that has been carried out by current and past members of my lab, literally dozens of researchers. So I want to take a second to thank all of them. And I wanted to start saying that almost 10 years ago now, I got really interested in this question about whether a computer program, a script, in some sense, a piece of software, could talk in a way that resembles a human users on online social networks or online platforms. And this is a really interesting question because it has a lot of implications, but it's not really new in a way because really the founding fathers of computer science discipline, like Alan Turing, thought a lot about whether a computer could deceive, in a sense, on an artificial intelligence, if you like, could deceive a human observer and make them think that they're talking to another human fellow as opposed to a computer program. So there are connections between this problem and the well-known Turing test. So I embarked upon this multi-years research endeavor, and we started developing a bot detection tool ever since I was at Indiana University 7-8 years ago, and we kept working on this particular problem throughout the last several years. This is an open source project that allows any researcher to use these machine learning tools that we developed to analyze online social media discussion on Twitter, to detect the presence of automated accounts. And we made this available to the research community to expand the capabilities of researchers in this field to determine the presence of automation online. So throughout this research journey, we also learned a lot about how bots look like and how humans look like. And now we're able to detect some type of bots, and we are able to learn some things about how they can be differentiated with respect to human users along different types of dimensions, the content that they post about, the temporal dynamics that they employ, the sentiment, the social network structure of these accounts and the users that interact with them. So one of the nicest application domains for this particular problem was during the 2016 presidential elections, where we thought that the possible or potential interference of bots in this particular discussion could have implications on the demographic. We collected data in real time, more than 20 million tweets in the 2 months in the run-up to the to the election, and we discovered that possible automation bot activities responsible for a portion of the article on November 7, 2016. This is, to the best of my knowledge, the only peer-reviewed article that appeared actually before the that was on November. So it's in good faith with the election, of course. Fact that users were in bots, the rate that was very similar rate they were interacting with other human users. So if you looked at the retweets, were retweeted by human users, there was no distinction between the frequency at which human users retweeted other human users and the frequency at which they retweeted bots. And this can be problematic, of course, because it means that maybe when we retweet political content, we don't operate the same level of scrutiny to determine whether the source can be trusted, let's say, or not. And this could have some implications if the discussion that is online is being distorted arbitrarily by, for example, an influence operation. This study opened up to larger analysis of Twitter. So in 2017, we carried out this census in which we tried to estimate what was the fraction or the prevalence of bots on this platform. And we compared this with a SEC filing that Twitter had to do in 2015 to estimate what was the prevalence of bots. So the filing said between 5 and 8.5%, but even our most optimistic estimate determined that this was an underestimation, and our realistic estimate determined that there were between 15 and 20% of such automated accounts on the platform. And in light of that study and the previous study regarding the 2016 election, there were a number of different important implications, including the fact that the US Senate started to investigate on the what today we know is the interference campaign that Russia carried out through the Internet Research Agency. So I want to play a very brief snippet of Senator Mark Warren, who is the vice chairman of this committee, who is mentioning some of our work during one of the investigation hearings.
Top Democrat on the Senate committee, Mark Warner, expressed doubt over Twitter's claim that it found only about 2,800 accounts linked to Russian operatives.
Concerned, sir, that Twitter seems to be vastly underestimating the number of fake accounts and bots pushing disinformation. Independent researchers, people who've testified before this committee, have estimated that up to 15% of active Twitter accounts, or potentially 45 million plus accounts, are fake or automated.
Representatives from each company said none has yet to identify the full scope of Russian interference on their platforms.
So I was personally very pleased to learn that our investigations and findings informed the Senate Investigation Committee, but also I was pleased to realize that a couple of months after our work came out, Twitter actually went into their system and they tried to scrutinize for automated activity and suspended a very, very large fraction of their user base. In fact, these reports suggest that nearly 77 million accounts, nearly 23% of the entire user base, was suspended since the first quarter of 2018 by Twitter themselves. And although, of course, some accounts might be suspended for a variety of different reasons, obviously automation is one of the more important reasons that lead to account suspension. So the findings that we reported somewhat reflected into the further investigations that were carried out both by the government and by Twitter themselves. And there are other implications that I briefly mentioned about, including those regarding the Russian propaganda campaigns that we helped unveil. And ultimately, one of the biggest implications of this work is that it informed two different bills. So in this slide, you can see the Bots Disclosure and Accountability Act of 2019 that Senator Dan Feinstein proposed at the country level, and then we have the SB 1001 Bots Disclosure, which is now operational law since July 1st, 2019 in California. This is a Senate bill that has been proposed by Senate Majority Leader Bob Erzberg. And if you go over both bills, they extensively cite and mention the results that we contributed, alongside, of course, results of several other different research groups all over the world. So shifting gear to current times, and in particular COVID-19, obviously we keep following very closely online social media discussion on a variety of different platforms, and our attention now is devoted to understanding how this topic of COVID-19 is talked about on social media. So we embarked upon a large-scale data collection that started on January 21st, 2020, which was the day when the first US case was announced. And we collected or kept collecting tweets ever since. So right now we have data collection of over 100 million tweets that are tracked in real time from the Twitter API. Following a number of keywords related to the pandemic, as well as trending keywords related to the disease, as well as other related topics such as shelter in place and social distancing measures, treatments, and so on. Not only we collected this data for our internal research purposes, but we also thought that we could do a service to the entire research community by making this data set public. So usually data access is sort of the first barrier to research, and many excellent researchers cannot necessarily carry out their investigations and work because they don't have access to such large scale data. So we posted this data set on GitHub almost 2 months ago now, and we also wrote up a research paper about this data set that is currently under review in a major journal, and that describes the data set itself. And interestingly enough, we know that there are already dozens of research groups all over the world that are using our data set for research purposes. In fact, the paper itself already accrued a number of citations and references in the press and in the peer-reviewed publications. So as you can see here, the repository itself already received nearly 100 forks and over 300 stars. So the dataset now is public, everyone can use it, and we encourage researchers all over the world to leverage it as one of the open source datasets available for this research alongside with others. But of course, we also wanted to try to understand ourselves what's in this data. This is a multilingual dataset, even though the majority of the tweets are in English. There are actually several dozen other languages represented there. We are focusing currently on the English language, which represents the majority, and trying to track how the evolution of this discussion mirrors events in the real world. So here in these two graphs, you can see, for example, the percentage of total tweets that are exhibiting different coronavirus or COVID-19 related keywords. And you can also see how, for example, verified users are talking about certain topics as opposed to the rest of the discussion. But to link back to what I was mentioning earlier, which are potential signs of automation and distortion, we are also currently trying to understand who is talking about COVID-19 in this particular platform. What is the prevalence of accounts that are likely to be automated, that are likely to be bots? And most importantly, are there any differences between the way regular users talk about this topic and the way automated accounts talk about COVID-19. And ultimately, what we really want to understand is whether this matters at all. If there is a difference, doesn't matter. So here on the right-hand side, you can see the results of a preliminary analysis that is summarized in a paper that is currently under review that looks at the distribution of score probability for extracted during bot detection and highlights some patterns that are quite striking. So we observe, for example, that the vast majority of users who are likely to be automated accounts are talking about COVID-19 almost 30 times more than users that are almost certainly human users. And many of these accounts have been actually created very recently, for example, in 2020. So we try to draw sort of a characterization, a very preliminary characterization of what topics the accounts that are likely to be automated are talking about with respect to what topics the users that are likely to be human are talking about. So this slide summarizes these results. And on the left-hand side of the slide, you see the keywords that are most frequent and most distinctive of these discussion carried out by likely human users. And you will see that the top narratives that emerge from this analysis include concerns about public health, risks, etc. On the other hand, if you look at the discussion from the top ranked accounts that are using automation tools, unfortunately, you see a very different picture. You will see conspiratorial narratives, fake news, etc. So we are currently digging into these associations to determine what are the implications of these possible forms of abuse where automated accounts are essentially riding on this pandemic and maybe hijacking, if you want, the coronavirus and COVID-19 trending topics to inject other forms of conspiratorial conversation. And with that, I conclude. There is a reading list that shows all the work that we've published over the course of the last 5 years or so, and we looked at a variety of different political events and democratic events all over the world, not only in the United States, but also abroad. And also we look at how social media abuse has implications and effects when it comes to public health in the pushing of anti-vaccination campaigns, etc. Thank you very much.
Great, thank you, Emilio. That's really fascinating work. So we're going to take questions in the Q&A tab. So if people want to write their questions here, and then I'll read the questions, and then Emilio can answer them. We have about 10 or 12 minutes for questions. So, okay, so the first question, Emilio, is there any concern that social platforms like Facebook and Twitter will use this research to identify human accounts that simply repeat messages their employees do not like as bots? Most of my Twitter connections talk about the top narratives from likely bot topics.
This is always an important concern because we always want to make sure that none of the research is used for purposes that could be associated to censorship and the violation of free speech. Ultimately, the way social media platforms adopt this research is not transparent to us. We don't know what are the type of countermeasures and algorithms and so on that they employ. If they were public, of course, it would be easy to defy them. So they are secret. They are kept secret for good measure. Ultimately, I think that one thing that is important to understand is that the detection of these forms of abuse is really challenging, and it's a cat and mouse game. In other words, the tools and techniques that are adopted to automatically post online are constantly changing, and there are some interesting recent results from a variety of different groups, not our own, but other groups in software engineering who are looking at how open source softwares that allows you to make bots has been changing over time, and how it is being incorporating ever increasing levels of sophistication, for example, artificial intelligence algorithms to generate human-like content. So I think that there is a shift ongoing, and we are moving farther away from simple bots that just post the same content to more sophisticated forms of automation that try to mimic how human users behave. So ultimately, the particular question or problem highlighted by the person who asked this particular question might not be very prevalent anymore.
Great. Okay, great. Thank you. So let's see. The next question is, being a Twitter user, may I differentiate between the tweets from a human and a bot? If yes, how? If not, what could be the reason that reply to the tweets from bots are less in comparison to that from humans?
So this is an excellent question, and this is in part what motivated our work 6-7 years ago when I was still a researcher at Indiana University, to provide a tool that is open to the public and allows users to get a sense of whether the content that they are observing is genuine or not, or whether it's being posted by means of automation, and ultimately give the users the opportunity to decide by themselves whether they want to trust that particular content or not, and whether it makes a difference to them if the content was posted by a bot or a human. In many, many cases, it might not make a difference to many of us. So the tool that I demonstrated at the beginning is public. You can simply search for it, and there are a variety of similar tools. So simple Google search for public bot detection tools will surface various results. And the reason why sometimes users are unable to determine whether they are being engaged in a conversation that is with a bot could ultimately lead to the fact that some of these bots in the past at least have received the same level of attention than human users. I think that the emphasis of our work is mostly on surfacing and analyzing and investigating operations that are just not only automated, which is maybe not the most important thing, but they are also purposely deceiving and trying to distort the online conversation. So automation is only a piece of the story, and it's just a tool to amplify the capabilities, in a sense, that a particular agent or actor has at their disposal to carry out these influence operations. But what we really care about is to unveil the operations that are deliberately trying to distort online discussion.
Okay, thank you. So, okay, next question is, how do you distinguish genuine need to know where the virus origins versus conspiracies? Is it not dangerous to use a judgment call, one's own judgment, to fit the result desired?
It is always, as I mentioned earlier, important to operate good judgment when we investigate and we look at this particular data. And it's also important to not blindly trust machine learning and artificial intelligence techniques and tools, but it's important to get also a qualitative understanding of the data and to manually validate the results. So what I showed today is, again, preliminary results that are the byproduct of a combination of this data science approach, where we try to explore the data and surface things that can be problematic. And the second step, that is a hand manual validation, human validations based on crowdsourcing plus human annotation that tries to determine, out of the many things that could be problematic, the ones that are indeed possible operations or possible campaigns aimed at amplifying or distorting certain messages.
Okay, thank you. All right, next question is, do you have a view on the success of the bots in accomplishing whatever the creators intended? For example, convincing the public of something that is inaccurate?
This is a fascinating, very important question, and I think there is not one simple answer to it because it varies across different scenarios and different applications. Unfortunately, when we look back at the 2016 election and we read, for example, the Senate reports or even the Twitter reports, we can understand the full scope of a successful application of this type of operation, information operation campaigns from a well-resourced foreign actor, like in that case, Russia. And this is a multi-platform effort. Of course, Twitter was a small piece of this story. Facebook and other platforms as well were heavily affected by this type of operation. So a well-resourced actor can definitely put together a influence campaign that has some impact in distorting the discussion online. Very, very recently, Twitter highlighted also other campaigns from other states or state-sponsor actors all over the world. So it is a problem that is becoming more and more prevalent as we speak.
Okay, so here's a related question, which is, has there been any inference on the sources of these bots, social media accounts?
Unfortunately, to do attribution, you would need to have a sort of access to the digital trails, the digital footprints, if you like, that would allow you to make this particular determination, things like the IP address of the user or maybe the VPN servers that the users are connecting from. We do not have access to that information. It's not publicly available through the Twitter API. However, of course, Twitter has access to this information. So in the past, in their reports, they've been able to make attribution to determine certain campaigns originated by particular specific state actors. So we are never able to do this type of attributions as researchers in, let's say the academic world, but it is possible to do that if you investigate having access to the root data.
Great, okay. Next question. In this case, to prevent consumption of misinformation, is it better to avoid platforms like Twitter altogether and get information more from official sources?
So I don't think, honestly, that this is a suitable solution, because the vast majority of people I know are engaged in one shape or form on using some online social media platform. However, one interesting set of results that I saw published recently by the University of Pennsylvania Professor Duncan Batts looked at the broader scope of information ecosystem and including the traditional news media and the web and so on. And they determined that fortunately, or it seems like the amount of fake news or misinformation that users are exposed to when they navigate online on online social media platforms relative to the amount of information that we are exposed overall when we look at the news online or when we tune into cable news or when we read our news from established news sources and news magazines. What we see online is a very, very small fraction of the overall. So I think that all in all, the prevalence of this problem is not as dramatic as one would be concerned about, but it is nevertheless an important problem to understand because, as I mentioned earlier, large majority of American people consumes, at least in part, their news media diet online.
Okay, great. And one last question, which is why can't Twitter proactively catch these bot accounts?
I think this is I think they actually do. I think actually Twitter is doing an increasingly better job at suspending accounts. However, unfortunately, there is a lag. There is a gap between the time these accounts start to operate and the time they get suspended. This is in some sense natural because it takes time and you need some sort of mounting evidence before suspending an account. So there is still a time frame that can be several weeks, sometimes several months, between the creation duration of an account and the time these accounts get suspended because they have been reported or because they have been in clear violation of the terms of service of the platform. So I want to sort of like cheer Twitter's effort to improve their security and the work that they have been doing over the course of the last several years to improve the safety of their platform. And again, the tools become more sophisticated, and therefore it's an adversarial game where you need to constantly improve your detection system to keep up with the new sophistication of the available tools. So it's an open question.
Great. Okay. Thank you very much, Emilio. That was really great. So now I'm going to turn things over to Bhaskar Krishnamachari, who's going to handle the second half of the seminar.
Thank you, Craig. So it's my pleasure, folks, to introduce our second speaker for this morning. And this is Christina Lerman. Christina, please take over and start up your screen. Just to introduce her, Christina is a principal scientist at ISI and also research associate professor in our computer science department. Her research has broadly focused on applying network science and machine learning to problems in computational social science, including social networks, social media, and looking also at social dynamics. So please go ahead, Christina.
Well, thank you very much for having me here. I'm going to be talking about network science of COVID, because we know that COVID has created actually a social emergency, as very much also in addition to the medical emergency, and made network science extremely relevant. So yes, we are embedded within social networks. You know, virus has figured out how to co-opt the very links that bind us together, you know, that bring us into close interactions with each other. Humans are social animals, and this is what enables virus to spread so quickly in our society. So in my talk, I'm going to cover two kind of basic introduction to network science and how it relates to virus spreading, and focusing on two questions that might be on the minds of everybody. You know, how quickly does virus spread? Why does it spread so quickly? And I'll talk about research in the network science that addresses this question. And also, similarly important question, you know, how can we stop it from spreading so quickly? For example, we are instituting different kinds of social distancing policies. How well do they work, and how can we make them work better? All right, so now, since the advent of online social networking platforms, most people have already a basic view of what social networks look like. Here's actually a view of Facebook friendship of my colleague, Dr. Greg Versteg, who was kind enough to generate this a number of years ago, and gives a good overview. So people know that, you know, they're connected, you know, they have some people who are connected to their friends, and there are interconnections between the friends. So most people have this notion of what social networks are, what they look like, but we didn't always know. And I wanted to tell people about this really fascinating experiment. One of the foundational experiments was done in sociology and psychology. Actually, this is Milgram's other experiment, you know, that helped people understand what social networks are and how they bind society together. So Milgram is probably more famous for his, you know, prison experiment, but this was the other experiment, the so-called small world experiment that he conducted in 1963, which actually gave us a lot of insights into social networks. So Stanley Milgram asked 160 people at random people in Kansas and Nebraska. He selected them from a phone book at random. So this was truly a randomized controlled study. So he asked this 160 people, he approached them and asked them to deliver a letter to a stockbroker in Boston. Of course, you know, these people did not know the stockbroker personally. He gave them instructions. If you don't know the target, do not try to contact him directly. Instead, mail this letter to a personal acquaintance who is more likely than you to know the target. So you get the notion. So if they don't know this person, they are supposed to send it to somebody who they think would have a better chance of knowing this person, and so forth. And the question he asked, actually, asked his colleagues at Harvard University also, what was their hypothesis? How long would it take? And very smart people who are very smart people, his colleagues at Harvard University would say, estimate, well, maybe it will take 100 hops or 100 steps to take to get to the target. So Milgram students went into Kansas and Nebraska to start the experiment and sat back to wait for the results. They actually didn't have to wait that long. Within the first few days, the first letter arrived to the target. It only actually went through 2 links. Eventually, 44 of the letters actually reached the target. Some took long paths, but the median number of links that was required to complete this, to reach the target, was about 5.5. And actually, this is where the term 6 degrees of separation comes from. Basically, Milgram showed that any 2 random strangers within the United States are connected by 6 these intermediaries on average. And actually, that was back in the 60s. Our world is small. Everybody knows everybody through, on average, about 6 links, but it's actually getting even smaller. So a study that was done already about a decade ago, mapping connectedness of Facebook users, showed that there's distribution of the number of chains that separate any 2 Facebook users who are picked at random, but the average number of links is 4.7. So which means if you pick one user in the United States and another user can be in Africa someplace, on average, it will require only 4 hops to reach the target. So this is the reason why the virus actually has so quickly spread through our society. Here's an illustration actually from Wall Street Journal that was doing contact tracing, which refers to really following what possible social interactions happened between an infected person and other people. So the virus was brought into England, to Great Britain, by this one person called Steve Walsh, who happened to be at a conference in Singapore in December, where several infected people have attended. And then after he left conference in Singapore, after he left Singapore, he went on a ski vacation in France, in the Alps, French Alps. And in his wake, he left, infected people there. And then when he finally returned to United States, before he found out that he was positive for coronavirus, he managed to infect other people. So this is actually this types of travel made the world much smaller. So the goal of network science is to look at this, to look at the role that networks themselves play in the spread of epidemics, social connections play in the spread of epidemics. So I'm going to just look at a couple of questions and show how, my personal expertise is actually studying here how information spreads in online social networks. But the basic underlying mechanism is actually the same, as I will show later. So we can ask questions as to how far and how quickly does a virus spread on a network? How large does an epidemic outbreak grow? How many people does it infect? And how does network structure affect its spread? Because this is very much understanding the role of network structure in amplifying or suppressing the spread can lead to better, more effective strategies to stop the spread of the virus. So this slide shows, in a typical setting, how far a virus spreads. So I'm showing actually on the y-axis, I'm showing the number of people that are infected during an epidemic outbreak. This is the number of people who get sick. And on the x-axis, I show the transmissibility of the virus. This transmissibility is basically how contagious a virus is, meaning if you have an social interaction, how likely an interaction between an infected person and a healthy person, how likely is the healthy person to become infected? So the higher the transmissibility, the more contagious the virus is. And you can see from the increasing plot that basically the more contagious the virus is, of course, the farther it spreads, the more people it affects. What is interesting to notice, there's this, and this is typically very much the case in all outbreaks, there's this critical value of transmissibility. Below this critical value, if a virus is less contagious, it will infect a few people, but then it will peter out and stop. will not find new hosts to reach. But above this critical value, the so-called threshold of contagiousness, transmissibility, it will spread and continue spreading, infecting more and more people. So you'll get an epidemic outbreak. And in general, like when you study spread on the network, the exact value of the threshold depends on network structure. Actually, there's some mathematical properties of networks that allow you to compute where the threshold will occur. Of course, you know, in general, when people talk about epidemic outbreaks, they don't talk about network structure. They don't consider network structure explicitly unless they do contact tracing. But instead, so epidemiologists instead talk about the reproductive number, the R0, that everybody has heard, I'm sure, so much about. R0 is basically, it's an approximate measure. It's related to this epidemic threshold, but it's an average number of new infections that each case creates. So if you have one infected person and then this person makes 2 other people sick, R0 is 2. But this is very aggregated, very fuzzy average number. People really count how many people have infected and how many new infections arise every day. But this R0 has a similar type of property of this epidemic threshold. It's because it's related to that. So basically, when R0 is less than 1, the outbreak will stop. There's a threshold. If R0, you have to have R0 that's greater than 1 for the infection to keep on going. So right now, a lot of the efforts you hear actually about Chancellor Merkel of Germany, she's talking about how to not just flatten the curve, but how to bring the R0 down to below 1, where it's close to 1 and pushing it down below 1 to stop the epidemic from spreading. So to give you a sense about R0 also governs how quickly an epidemic is spreading. So it's a measure of transmissibility, of contagiousness of the virus. So for example, a seasonal flu, R0 is 1.28. So basically, if 4 people are infected, one of them infects 2 people, but the remaining 3 infect only 1 person, that's R0 is 1.28. It's no big deal. We deal with this kind of numbers all the time. Spanish flu, in the 1918 Spanish flu, on average, infect about 2 people for each sick person. The 1957 flu, which for some reason actually people have completely forgotten, but there was a pandemic flu in 1957, had R0 of about 1.65. The H1N1 flu, probably many of us remember from a few years ago, is about 1.5. And related to them, COVID, scientists are still trying to estimate what the reproductive number of COVID is, but the estimates range from about 2 to about 6. So you can see it's actually much worse, much more infectious than seasonal flu, which makes it more dangerous. Of course, it's nowhere near as dangerous as measles. That's why measles is such a public health problem, because it's much more infectious. Its R0 ranges between 12 and 18. But luckily, we have a vaccine against measles, so we don't have to worry about this as much. Okay, so this is the basic kind of network dynamics of epidemic spread. That basically, if it's infectious enough, it will spread and continue spreading. But network structure can actually act locally to raise the R0, to make the virus spread more easily. For example, hubs, this is network. So on the left, I'm giving you a visualization of a typical network. Actually, this is a well-studied benchmark network in network science. And the hubs actually refers to the well-connected people. This is the people who know many others within the network. And these hubs tend to amplify the contagion. So for example, this hub, this highly connected person, if this person becomes sick, then he has a possibility of infecting many others. These are the so-called super spreaders. You've likely read about super spreaders or super spreading events. For example, South Korea has been very good about doing contact tracing, trying to locate everybody who a given infected person has come into contact with. So they've actually noticed that after patient 31, the outbreak actually vastly accelerated after patient number 31 became infected. And this patient number 31 was a 61-year-old woman in South Korea. And when she got sick, she actually attended 4 church services. And she infected at least 37 people. So she was the super spreader that accelerated the spread of COVID in South Korea. But what we have been studying, actually in my research group, we've been studying actually other network structures. So besides the hubs, there are actually other properties of networks that either amplify or slow down the spread of contagions. So one property we looked at is so-called degree assortativity. So in social networks, highly connected people tend to be connected, to be friends with other well-connected people. So hubs are friends with other hubs. And this can actually amplify contagion. And you can see here in this example, if each exposure, each link has some probability to infect, make a person sick. If these 2 people who are both sick, if 2 hubs become sick and they actually share a circle of friends, then they actually are much more likely to get their circle of friends sick as well. And when we're looking at how information spreads on networks, for example, we can actually study this both empirically and also theoretically, mathematically as well. So I'm just showing you a plot where we took the same network, one network that has the same degree distribution, meaning it's the same connectivity of nodes. It's the same network, but then we can rewire it to make it more assortative or less assortative. So make it more likely for hubs to link to each other or less likely. When it's less assortative, hubs are less likely to link to each other. And we show here in this plot that actually when in more assortative networks, actually the virus does spread more easily. There's we can actually suppress the threshold on which the network becomes unstable to outbreaks. And these outbreaks can grow more quickly when networks are more assortative. All right, so now I wanted to just talk about, okay, so networks can spread contagion. What can we do actually? What kind of social networking policies can stop virus from spreading? So social distancing orders, they aim to reduce the number of social interactions people have. You can actually close schools, cancel sporting events, close non-essential businesses. The directives have varied. Basically, all these efforts tend to reduce the size of the crowds that gather in one place, but there have been all kinds of the orders. From initially, California started with banning crowds of 250 people or more. Then they lowered it to 50 people or more. Trump's orders actually said groups no larger than 10. Germany is more stricter, saying no groups larger than 2 should aggregate. But this is the question we can solve. What is the safe crowd size? How effective are these social distancing measures? So I'm illustrating this concept of social distancing on the same network. So suppose we start on the left-hand side. We start with the original network that is well connected. Everybody is about 3 hubs removed from everybody else. The largest connected component in this network is the entire network, 34 people. If a virus starts in one node, it actually has the potential to spread, in fact, everybody within the network. So the goal of social distancing is to reduce this, to break up the network to reduce who can get infected. So I start targeting, eliminating the popular to prevent crowds. I can eliminate the hubs, the nodes that are connected to most others. So if I say, if I close down or eliminate crowds of at least size 15 or more, so eliminate nodes that have 15 or more links. It does break the network a little bit, but not very much, actually. The largest connected component is 28, meaning anybody who, a sick person here can still infect 28 or most of the network, most of the population. If I start limiting the crowd size to 10, for example, the largest connected component does shrink, but still 16 people, half of the population is still connected and can get sick during an outbreak. Only when I get down to limiting crowds of size 5, then it breaks up further so that the largest connected component only has 8 nodes in it. So 8 people can get sick. So that was my illustration. Actually, in apply, we want to see how does it work in a real world network. And here we actually tested this idea in a real world location-based social networking. So this is when social networks that allows people to check in. So we know where people checked in, who was nearby at the same time, and we can say that people are connected if they spent more than 20 minutes in the same place. So for example, people checked into a restaurant, so because virus actually can stay on surfaces for hours, survive, and that if one sick person was at this restaurant, then another person who visited this restaurant in the near in time to that could have possibility of getting infected. And what I'm showing here, we computed, is actually the size of the largest connected component. This is like if one person was sick, how far does the epidemic virus have a chance to spread? How many people can it actually potentially infect? So that's the size of the largest component. And on the x-axis, I'm showing what locations can I limit. So if location has more than 10 people, this is, for example, where x-axis is 10. This is showing what the largest component size is. So the original network is dashed lines, shows the size of the original network, and the solid lines show the size of the largest connected component once I start closing locations that have at least 10 people in it, or at least 5 people in it, and so forth. And what you see is actually the network stays remarkably well connected. You have to close down locations and only allow crowds few to at most like 2 or 3 people before you actually see sizable impact on the size of the connected components. So that's why it's really hard to get social distance. That basically means that there is no really safe crowd size. The network will find time to spread. All right, before I run out of time, I just wanted to show you something. You can apply network science to study propagation within the community. This plot is showing how the neighborhoods within Los Angeles, and you can actually go to this link to see the interactive, and you can see there's hotspots in West Hollywood and also now in Florence, Firestone. Hotspot, there are lots of people actually are infected in this area, and they're trying to understand whether we can apply network science ideas to understand where the next hotspot will be. So for example, we had the data from US Census. Before the pandemic, so many of these locations, popular locations, like for example, this is downtown, is the circle, and there's Burbank as well. Social distancing measures, so maybe they're not as vulnerable right now to outbreak. But where the virus is spreading right now is actually Brentwood and the West Hollywood. This is have high number of locations. So anyways, so stopping the COVID-19 is actually one of the greatest challenges that network science has actually spread. We will need network science to actually stop the spread of the new vaccines. And now actually we'll conclude with this, and I'm happy to take questions.
Great, we welcome our audience to ask questions through the Q&A.
Anybody? So, for example, people might actually didn't have a chance to talk about, but people might say, you know, why wear masks and how effective can contact tracing be? So what masks do is actually reduce the R0. They reduce the transmissibility of the virus. So that's why, so especially when you're in public places, it's so important to wear masks, because to enable contact tracing, like if you reduce transmission in public places, you can enable people to more accurately determine the spread of through your social contacts.
So we have a couple of questions on the Q&A. One is the next hotspot based on positive cases that were tested? And also, how about asymptomatic spreaders?
I don't know how to answer the question about the asymptomatic spreaders, except masks will have it. But next hotspot, that's what we are trying to understand, if how movement, job movement, mobility of the population within the area, how it contributes to the outbreak next hotspot. So right now, unfortunately, did not identify like the hotspot in West Hollywood. You can go to navigate to the link there. Oh, I don't have it anymore. But the hotspot was actually, there's two hotspots right now. One is in West Hollywood in Brentwood on the west side, and one is Florence Firestone, which is in inner city Los Angeles. But actually through job movements, I didn't see any connection from them. They seem to be independently spreading. But the spread between West Hollywood and Brentwood, they seem to be all in the same cluster of neighborhoods.
We have a question that asks, do these network algorithms consider the temporal dynamics of infection? So for example, even if the R0 is 5.7, someone may not spread it to 5.7 nodes in a single step, however that might be defined.
Sure, that's right. I mean, that's a very important question. And actually the dynamic network science is still in its infancy. So there is actually many things we don't understand how to model and control. So R0 is a very rough measure. It's basically like a very blunt instrument to give you a rule of thumb about how transmissible something is. More fine grained, like the dynamic R0, dynamic network, dynamic spread will need to be developed methods to understand dynamics of networks.
So here's a related question maybe about kind of the understanding what these R0 definitions mean. Does an R0 value of 1 mean that one person can only infect one other? Can that person by definition affect new people over time?
Yes, so it definitely means that this again, R0 is a very blunt measure. So on average, so when the R0 we bring it down to 1, and actually I saw recently in many recent analysis of statewide shown that many states actually R0 has declined to 1, meaning on average, the cases are not growing. Like there's no the number of new cases is not increasing every day. It actually stays stable. So whatever one sick person creates another one sick person, new person. So there's the same number of new cases every day, which is a good place to be in. Of course, it will be better if actually there's fewer and fewer new cases every day. If one new person infects, most of the time doesn't affect anybody, maybe every other day they infect somebody else. So we need to be below R0 equal to 1 for it to stop. But at least we are in many places getting to a good place where there's not growing the number of new cases is not growing.
We also have a question that asks, can your insights identify areas where lockdown should be implemented more strictly than others? Should all areas be locked down with the same severity?
That's exactly why we want to do this kind of analysis. Looks like there actually, if I cannot share the screen anymore. I'm going to post let me actually, in the chat window, I'm going to post the link so people can see. Actually, wait, so to all panelists and attendees. Okay, so you can actually see that actually there is the hotspots areas are nearby to each other. So like West Hollywood, we watched from early March, actually Brentwood had the most number of cases, then West Hollywood popped up. But since West Hollywood popped up, neighborhoods near it, like Fairfax, have also become hotspots, have had large number of cases. So there's definitely like the spreading component because people are nearby or tend to interact more. So that's what we can use this. So that's neighborhood level analysis can highlight where it's going to spread more. And my hypothesis, I suspected that where people travel for work, for example, would also be where the next outbreak would spread. But so far I haven't been able to see the link between Florence Firestone in the inner city and, but I think since Florence Firestone is actually so close to University Park and other USC locations, actually, people should be careful when going out and getting chance interactions with infected people. I cannot hear you, Bhaskar. Still cannot hear.
Okay, we have some more questions.
Okay.
Let's see if we can get through at least a couple of these. What's the difference between using R0 and mu, which is transmissibility for modeling?
R0 is basically if you had insight into how likely the virus was to spread along each individual interaction, along each link. That's the mu. That's a more fine-grained measure. R0 is kind of average notion. And again, mu depends not only on the biological properties of the mechanism, it also depends on what people do. So if you wear a mask, you reduce the mu, and you also reduce R0. Okay.
Just do maybe one last question. Is there any way to track how R0 changes with different government orders, such as CDC suggestions that are being announced, social gathering bans, face must be covered, etc.?
Yes. Yes, and actually people are doing exactly that. And that's what I said. I saw on Twitter, somebody posted on Twitter analysis of dynamic R naught, so how R naught is changed based on the number of new cases and show how it's been decreasing in most of the states. It's still above 1 in several states, but in California, for example, it's actually down to 1 right now.
Great. I think we'll have to stop here. I know there are probably people with more questions.
People are welcome to email me with their
reach
questions.
out to you and